Hey everybody, welcome to the Cheshire Cast. I am your host, Corey.
And I am your host, Patricia.
And together we are the Cheshire Cast.
Welcome back.
And here we are. We're back again.
Okay.
We've
done a bunch of episodes.
Yes.
Corey. Are you gonna put them all out? You're gonna tease them out week after week.
I am gonna put them all out. I think I'm moving some of them around a little bit.
Okay.
Based on content. So I might put, well, I don't know if it's going to matter. I'm not even going to say, but
COVID is as COVID does. There's a lot of COVID episodes.
Yes. And we're going to kind of skip the small talk because we don't have a lot of time with our guest and we had a little bit of technical issues. So we're kind of going to jump right into it, but
it was my fault. I'm sorry.
It's okay. But we have with us Dr. Wu.
Better be.
Epidemiologist from Hartford Healthcare. Also, if you were an avid listener, you know that he was on our show back in March with Liz Linehan.
One of our last in-person shows.
Yeah. It was,
I miss you. I miss you all.
Yeah, and we miss you too.
You'll remember him for his in-depth discussion of the nature of poo.
Yes.
Oh, can we talk about poo? That would be awesome.
We did that already. Done. No,
a lot of people didn't like that.
COVID shows up in the poo. It does.
It still does. And when you flush, don't flush.
And you
6 feet.
You rapidly became one of our favorite guests. So kudos to you for that.
It's the sense of humor.
So welcome back to the show.
Thank you. Happy to be here. Thank you so much.
Anytime.
Well, we want to catch up a little bit.
Yes.
So you weren't on that long ago. Usually when we have repeat guests, it's been months, but life is coming at us so fast in your realm of expertise, epidemiology, that we thought we'd have you on as we begin our partial reopening process. And the amount of science that we've learned over the last, you were probably with us, 8 weeks ago-ish?
Yeah, about right.
The science and the evolution of this novel virus that has gone on in the last 8 weeks, we need you on just to catch us up.
Sure, absolutely.
Okay, good.
Should I just go?
Where do we start? Epidemiology.
I don't want to just go because then
I could.
I know because you're super
We're
smart.
On.
No, I have ADHD and I'll just stop. You won't be able to stop me.
I find that makes a very good radio personality.
I think I'm guilty of that too. I'm on my screen, Trish. I'm above you.
Oh.
But whoever's, I don't know where I don't.
I'm pointing at both of you now.
Yeah, no.
Sorry. Technology.
So I'll kick it off, and I'm sure Trisha's got some questions. But the first thing really is, back in March, you were working hard to kind of figure things out. I mean, you knew what you knew, but you had made mention that there was so many things that were coming, and I'm curious what over the past few months, all the things that have transpired. How on the money do you think you were, or do you think not you specifically, but the medical scientists, the World Health Organization, CDC, how on point were they, and where are we now with it?
Yeah,
I hope that makes sense.
It depends. Yeah, it totally makes sense. You want the glasses half empty or half full view, because it depends how you look at it. And so where are we now? Well, let's start with the predictions. I think we were a little late. We knew this was coming. I think when we spoke, it was already here. So we were a little bit late with that, I think. What did we get right? For Connecticut, we knew when the peak was coming, and we predicted that pretty good. And that was late April, early May for our county. It was a little bit early for Fairfield. But in terms of being late, I don't think it hurt us as much at a local level, because our hospitals were prepared. Yep, go ahead.
To have some amazing hospitals. We happen to have some amazing hospitals.
Yes. And I work behind the scenes. I mean, I saw patients and I still see patients, but boy, our nurses, I mean, wow. I mean, they knocked it out of the ballpark, and you saw all the pictures of the what their faces looked like with the masks, and just the countless hours. It's just the term superhero doesn't apply to the people behind the scenes or the physicians. Well, some physicians for sure, but the nurses for sure. They were, and they were ready. They were ready and willing. And what I want to commend them, and I don't want to short the physicians by heaping praise onto the nurses, but the physicians and nurses that rushed into the breach, really incredible. I mean, and maybe it's a cliche for me to say that, but I don't think enough accolades could be given to them.
I like how you're speaking like it's over. Like, I don't hear second wave in that, and the way that you're talking about rushed. You're using so many past tenses. I like it. I don't know. I may be willfully being obtuse about it.
Well, he did say glass half full.
I'm giving the half full. Yep.
Okay.
Where did we miss? Hydroxychloroquine. Huge swing and a miss. Every study that's been coming out since has basically said it may not only be helpful, not helpful, it may be actually dangerous. We used it for a little bit, but we were quick to get off that train. There are newer drugs that are out there that have shown a lot of promise.
Treatment?
For treatment. Yep.
Yeah.
So remdesivir is one. That's the big one from Gilead. Or I guess I'm not supposed to say that. This show is not sponsored by Gilead. I got to say that.
Yes.
I'm not sponsored by Gilead.
I've heard it on the news a lot, so it's said enough where we're in the clear.
Yeah,
but we have no affiliation with that company.
Yes,
or that drug, and you can use generic. We have nothing against generics.
I'm all for generic for sure.
Yeah. Me too.
And what we are developing, and so let me give you the glass is half empty. Not much has changed since 2.5 months ago, except that we're a little smarter. We
numbers.
We have some numbers. We have drugs, some drugs that may or may not work, and we're more prepared. And so the second breach is about to open. I think it will. The positive thing about this is that, and the big thing that we have that's different besides those things is that we have a lot more testing now. And testing, I think, is going to help us.
What's the efficacy of the testing right now? The efficacy?
Efficacy, yes.
How's it going?
It's good. It's good if done correctly. So there's many different tests that are out there. The tests that we are using, there's two. And one is what I call the nasal pharyngeal, which is where you tickle your brain. That's where you feel it. You don't really tickle your brain, but it feels like they're tickling your brain. And now,
how far can it go in, man?
Yeah, it hits basically the back of your throat. That's where it stops. But it just feels.
I thought one went in and up your sinuses. Is there one that does that?
Oh no, we wouldn't know. ENTs have that capability. They have tools to do that, but we don't do that. Yikes. It's basically a long Q-tip that reaches to the back of your throat.
So it goes up the nose and down the back. Okay, I thought it went up and all right. See, yeah. I'm learning. That sounds a little bit more comfortable.
It's uncomfortable for people. It tickles. Yeah. What I tell people when I do it is I tell them I'm going to make you laugh, sneeze, and cry all at the same time.
And then it's over.
And cough. Yes. And then it's over. Well, we got to keep it in there for a little bit.
Have you been tested?
I have not.
Okay. Have you had you've obviously had a ton of exposure, but you've managed to remain healthy?
There were times where I was overly tired and I'm wondering, did I catch something? But am I working long hours?
I think everybody's felt that over the last 2 months. I think everybody's felt that at least once.
Yeah. Wake up with a scratchy throat and it's just allergies, but you're like,
oh
no.
Yeah. Well, the pollen.
But you have direct exposure.
Well, it's kind of weird because it depends how everybody's social distancing is. So I've been really good about my social distancing. So that's why I've been not too worried about catching it and giving it to somebody else. Even at work, we switched to something called universal masking, and that's everybody in the healthcare facility wears a mask now.
Okay.
I think last time we talked about we didn't do that.
Right.
We didn't have the masks.
Yes, we didn't have the masks. And so I think I've been really good about that. And then when I come home, I mean, I hate my whole family, so I don't talk to them anyway. So that's perfect.
Lies. You shower.
Yeah, definitely. I wasn't one of those getting naked
you
on the
cry
front
it out
porch.
in the shower like everybody else.
Yes, exactly. With my beer, with my shower beer.
Yeah, the wine holder on the wall. I know.
Exactly. But I definitely was not one of those getting naked on the front porch and disturbing the neighbors.
All right. You were.
But
I would if I had somebody coming into my home that was coming out of the medical field, where'd he go?
Somebody tried calling me. Sorry.
Oh, the nerve. I think I would not. I wouldn't give them troubles for getting naked on the front porch. Like, I get that level of carefulness, especially a month and a half ago. But I could see now being a little bit more relaxed and, making sure your hands are washed as soon as you come in, and maybe even showering, changing your clothes if you're in the medical field. You know what I mean? Like, I could see that keeping that level of caution, especially with word of what is coming within the next possible week or so since we've opened.
Yeah, and I don't blame people for doing that, and I would actually encourage it. I love that level of attention to detail and hygiene. In fact,
you think it's effective?
What's that?
You think it's effective?
Weird. It could be. So, one of the things we actually just recently learned is that it probably doesn't live on surfaces as long as we thought.
What did we think?
We thought, like, originally when it came out, they had done some studies, and it was in a perfect setting where there was no air movement and there was nothing to disturb it. There was no air circulation. And it was like, oh my goodness, it lived on surfaces for X amount of time and it stayed in the air for X amount of time. But that's not true, because that was not in a perfect environment. I mean, that was in a perfect environment where it could be. Now, as we know now, the air is blowing right now. The surfaces are different. Every surface is not the same. It probably doesn't stay on the surfaces as long as we thought it was before.
But I heard a study where a cruise ship, 17 days, they found live virus. 17 days of an empty room. Yeah. Was that just, did you hear that study, or is that just one of the sound bites that crosses the airwaves?
So I think that it definitely wasn't one of the sound bites. I think it's true, but what they found was remnants of the virus. And so we don't know if that virus is live or dead.
So you don't know if somebody could get sick from the virus, that particular virus. All right, fair enough. But it was still remnants of 17 days, which is kind of, that's a pretty hardy virus right there.
Well, and it gets even worse in the sense that for some of our people who are positive, they are still testing positive up to 6 to 7 weeks out. But we're pretty sure that's just dead virus that we're picking up, but we're not 1,000% sure. So we don't know if they're infected. But we've had some good literature since that said that we've been unable to culture the virus after 9 days of testing and symptoms. Does that mean that they're not infective after 9 days? That's not necessarily true, but the fact that we can't culture it after 9 days, that's a good sign. So when
you say infective, do you mean contagious? Like just contagious. Translating it a little bit? Okay.
Yep, absolutely. Right. Contagious. Yeah.
So a virus, you said like up to 16 days, parts of the virus have been found. And immediately my brain went sci-fi. And I started thinking, like, is it possible then that there's some virus trapped in under some lava flow, living in some weird bubble, that if we drill down into it, that virus can then come out and potentially be airborne and wipe us all out?
Like digging in the Arctic?
Yeah.
Yes, exactly.
Bacteria.
And the bad news is, yes, that is actually true. No, I'm kidding. It's probably...
And it actually happened about 3 months ago.
Yes.
Well, I think that was the basis of 12 Monkeys or something to that effect. But
Brad Pitt, great movie.
I've heard tell of that. I've heard tell of that, digging in the Arctic or coming up with like mammoth bones that you could possibly release, the next extinction. But that we digress. We have enough sci-fi in real life. We don't actually need to talk about.
No, we don't. I'm sorry to sidetrack, but that's just, I'm ADD, just like the doctor. So
this virus actually has every making Can you imagine watching this movie in 10, 15 years, or is that still too soon? Like 10, 15 years, this movie will be absolutely amazing.
Oh, they've already made it, Contagion.
I watched it. I watched it. I watched it when this first happened, and we've been watching.
Is that the one with Matt Damon?
Gwyneth. All I know is, I'm sorry, spoiler alert. Gwyneth dies early.
Yeah, Gwyneth Paltrow.
Yeah. She's like patient X. She got it from a chef.
That's
his wife. It's Matt Damon's wife.
You just gave away the whole plot of the movie, Trish.
I do that. I'm one of those people. No, I don't. I'm sorry. Everybody's seen Contagion. It's like 50 years old right now.
It's not the Dustin Hoffman one. That was another one.
Outbreak.
Yes. Outbreak. Okay, yes. So in that one,
that one was the monkey.
We watched so many.
Yes.
Outbreak with the monkeys. Yeah.
Well, that was the one monkey.
Yes.
That became friends with the girl.
If you want to get close to real life, the Hot Zone is the
I'm writing it down.
Movie. Yeah.
Hot Zone.
The Hot Zone.
That was about the Marburg virus, which is a cousin of the Ebola, and that actually it kind of got loose a little bit in Virginia. So
really,
yeah, pretty cool.
I'll check it out. What is what's the biggest concern with things opening back up? I mean, and I say concern because are based solely on what I'm seeing. Is I see people outside dining. I see clusters of people together, waiters, walking to different tables. I don't see what I think is supposed to be social distance or physical distancing. Mm-hmm. What's the concern and why is it even okay to do any of that?
Yeah. It's a great question, and that sort of goes back to what we were talking about before. What has really changed? And not much has changed. I said we were a little smarter, we're more prepared. We may have some more meds, but there's no vaccine, and this probably isn't weather. I mean, I think it's weatherproof, as evidenced by what's going on in Brazil right now.
All the geographies have been tapped, all of them. Every weather pattern has grown this virus.
Yes. There is some literature out there that says maybe above 77 degrees, its ability to replicate and transmit is maybe a little less, but
that's external, right? That's if someone's not coughing right in your face. That's just like airborne contagion.
Oh yeah, the viral load, and you've probably seen all the lovely videos of people like smoke, they're coughing, and then how far it goes, and all those lovely things. But the big thing that's changed in a negative way from 3 months ago is that the fear is gone. People are less
fatigue has set in.
Yes, and fatigue has set in, and people. I don't want to say that they care less and they're not more cavalier. I don't want to say that, but it's just
America's over it. We can say it. America's over it.
I think we've accepted it as reality, and you look at other examples in our lives where we have become accustomed to this. Influenza, tens of thousands of people die every year, and we go through the whole spiel of get your flu, shot, and so on, but it doesn't faze us that tens of thousands of people are dying every year. We could talk about gun deaths, 50,000 people a year, and people aren't fazed by that anymore. And maybe we're getting to a point with coronavirus, and I hope not, but that we're getting to a point that people are less and less fazed. I don't know. I don't know what the psychology is.
It is a psychology. That's exactly what you just hit on. And it's a psychology that, just like the virus, it's a new one for us. So we'll see how long it takes for us to get back to a normal and see what number is acceptable to function an everyday economy, an everyday lifestyle with. I mean, what is that number? What is that number? Right now, we're at 350 global deaths ish. 350,000 global deaths from COVID. And we're about 3 months into, we'll say we start that around late January. So we're about 3 months of calculations. Flu is about global. I think flu it's a fraction of that, a fraction of COVID deaths. So I think if COVID had an agent and whatever media presser COVID has, it deserves every penny that COVID is paying it,
Yeah.
because it's the press that it's getting.
Yes.
And
totally.
its publicist has worked really well for it, because it's going to have so much more access to proliferation because of how underplayed. But we can't live in fear. There's such a gray area in between, and we can't find it. So here we're opening, because the economy is really important to the powers that be.
Yes.
What's the word on masks, Doc? Like, you got the guys over here saying, the masks aren't helping. Don't worry. It's a government conspiracy to control you. And you got the people over here that are saying, listen, just wear it to protect yourself or to protect others or whatever. I mean, and then I'm hearing mixed messages from CDC and the World Health Organization. Do masks help?
Masks help. There's no doubt that they help. They
in
help
what capacity?
And everybody's mask is different. But in general, will a mask help prevent fomites from spewing from your mouth and your nose? Yeah, absolutely. Will it help prevent somebody else's spittle come in your direction? Yeah, it does. Are they foolproof? Absolutely not. They're not foolproof. And, some of the infections we get are people who don't know how to take their masks off properly as well. So,
contaminating themselves.
Yep, exactly. And then they pick their nose afterwards, or they eat their boogers, and then it all goes back to
you
bodily
don't even
fluids.
have to do that. That's you could just literally do that.
Yeah,
you go like this,
exactly.
Or like a little side scratch, like
scratching my nose, pulling the nose hair out.
It doesn't have to be full on entry. You can still get sick.
Exactly. But
I have a question. Go ahead.
No, I was just going to say, that being said, wearing masks all the time is not helpful. But when you're in a crowd, it is helpful. But if you're outside
close
in your
talking, right, with somebody who you're not quarantined with, if you're going to sit down and have a chat and you're 2 feet apart, and this is a person that you're not exposed to, if you're going to be sitting there and animatedly talking, you might want to mask up.
Yeah, pretty much. I would agree. It's kind of like, you all know that I don't like to shake hands, and I call it the social distancing shaking hands when you're talking to people. The mask is my equivalent of not shaking hands as well.
There's such a stigma to it for some reason in this country. Other countries have been doing it for flu for forever.
Yeah.
Just for the flu. Just for flu season, they do it. We, for some reason, have thrown it down the chute of cultural divide. I don't know how. I don't know what. I don't know why. But there it is. It's been laid down with what's your political preference? What makes you angry? I don't know why that was so attached to it, because that's going to help proliferate the virus.
Yes,
I don't
absolutely.
understand.
Yeah.
I have a question about viral load.
Yes.
If you could explain viral load, and if you can clear up for myself and my husband, who have had this conversation a few times, does viral load of the person who's contagious, from the person who infects other people, does their viral load increase the likelihood of somebody getting sick from them?
So when you extrapolate it to something like a blood-borne disease, like HIV, for example, we know that people with well-controlled viral loads in HIV are much less likely to transmit something like that. The viral load is important because, and it probably holds true with something like coronavirus, because so we've determined that your viremia, or your viral load, is highest around the time when you first have onset of symptoms. It's about a day before onset of symptoms to about 3 days after symptoms have started. So it's about a 5-day window. And that's when your viremic is at its peak. And when it's at its peak, you have more virus. And when you have more virus, you're more likely to shed more virus, whether it be in your speaking, in your spittle, in your airborne, your airborneness, I guess.
Excretions.
Excretions, yes.
Your airborne speaking aerosols.
Yes, your drop. Well, and that's actually, I have to distinguish between airborne and droplets. So I should really say droplets. And yeah, you're going to have a higher peak with that. And it's weird. Infectivity matters a bunch of different things, and your viral load is certainly one of them.
Is viral load like a concentration?
Yeah, it could be.
Okay.
Yeah, okay. That's a good way of looking at it.
It's also a great name for a metal band.
I think there probably is.
If not,
I'm going to Google it right now. If not, I'm trademarking it.
This episode's name should be Viral Load.
Viral Load.
So you were next going to talk about, so I was bringing up Viral Load because my husband and I talk about it. Of course there is. Oh, well, can we still name the episode Viral Load? Let me guess. They're metal.
Wait, you're coughing. Go isolate yourself in the hemp fields.
Oh boy, that's it. 14 days of video games, Corey. So my husband and I talk about it. Like if you're around somebody who's within the highest peak of their viral load, if you are infected at the time, if you're infected with a spittle of higher concentration, as opposed to a piece of spittle, this is so gross. I'm so sorry for everybody who's grossed out for listening.
Yes.
If the viral load in that one piece of spittle is higher because that person's in that peak viral load phase, or as opposed to somebody who's before or after that, with all things being equal, would that create a higher infection rate than the lower viral load? Just because you're being exposed to more pieces of the germ.
It depends what's in that spittle so let's really gross you out. Would I rather have like random spittle from a person who's at peak viremia than somebody who's maybe 4 days past but is hocking a loogie and spitting in my mouth? Yeah, I'd probably rather have the former rather than the latter.
But it has nothing to do with contagion or infection rate from that.
In general, if the person who has a higher viral load is probably more likely to be infectious. How about that? Maybe that's the best way to put it.
So you're more likely to become infected from the person with the high viral load, or am I extrapolating too far?
Yes, you are. You are more likely to become. Yes, that is true. Yeah.
All right. That's a debate my husband and I have been having because we're true nerds. And thank you for clearing that up. And I can't wait to confirm that with him because.
What was he saying? It didn't matter.
No, we were both there, but we didn't know if we were right or not. We didn't know if we were just theorizing, armchair scientists.
Hey, everybody. Welcome to Dr. Wu's marriage counseling sessions.
We both won. How cool is that?
Oh, wait. No, not everybody gets a trophy here. No. There's got to be a winner.
We'll fight about something else, something less important.
Yeah, you got to pick
we'll fight over
the
battles. The dishes. We'll fight over the dishes later.
But that's lately
huge.
At home, I say to my wife, I'm like, yeah, this is not the hill I'm dying on. So
that is
I'll see what comes up tomorrow.
Yeah, something else will happen today.
That's actually a great saying for life. People need to understand this is not the hill I'm dying on. People just need to know when to give up, or when they're not in their lane. Well, that's one of my biggest things that I like to say is just everybody stay in their lane.
Wait, are you saying that you're getting people that haven't had the education that you have and the experience you have telling you how this virus works?
Hydroxychloroquine?
There's so many diseases. I get enough hate already, so I'm not going to even go there. But there is a nice little meme that says and this didn't apply to me, but I saw this. I thought this was hilarious. It was like, somebody was criticizing somebody else, and I forget exactly the context, but it was like, so you're just going to listen to what the CDC says and just take that for gospel? And the other person's response was like, dude, yeah, there's no amount of Googling I can ever do that will override the CDC's expertise and research that they've spent decades
another
on doing.
Another cultural phenomenon that we are experiencing that's being so perfectly highlighted by this disease. Yes. Facebook University degrees. Absolutely.
Yep.
Everybody's an expert. Everybody's an expert.
Right.
This one's a little different. I will pretend not to be the expert because it's a brand spanking new disease. The only difference for me is that I have medical background that allows me to understand things. And I've also basically breathed and, slept with this disease for the last, couple months so far. So it's been my entire life.
So you've seen it.
Yes.
And you've experienced, I would assume, all aspects of it.
Yes.
And you can confirm wholeheartedly that it sucks.
Yes.
And it's
real.
It's real, and it's a very difficult thing to recover from. And even when you recover, it's a difficult recovery. I mean, I know two people that are friends of mine that have been recovering from it for, it feels like 2 months. You know, and he was hospitalized on a ventilator. Luckily, he you know, is home now, but they still tell me like they're not 100%.
Exhaustion.
Yeah. The rehabilitation process from it for those who, and I think, thank goodness that they're home. But yeah, we are seeing a lot of vented patients that are, they're vented a lot longer. People are in the hospital for a long time with this disease. Definitely. More so than a lot of the other infections that we've seen.
Is it because of the secondary complications, or is it because of oxygen?
I think it's a secondary complication. So we are learning about, you know, what it does to your lungs. We are learning about blood clotting phenomenon, kidneys, and just general
immune responses.
Jeez.
Yep, absolutely.
And stuff is still being learned. That's what's crazy about it.
Yeah, we'll all be
what
dead
we
and
know
gone.
is already terrible.
Yeah, and we'll still be learning about this disease, just like a lot of other diseases. You know, tuberculosis has been around for the longest time, and we're still trying to figure out, you know, about that terror, you know, that disease as well. But what happens is that you waste away when you're in the hospital and you're on a ventilator. You know, we feed you. We do our best to do rehabilitation. Obviously, not when you're intubated, but even afterwards. But yeah, it's a quick downfall, and it's a very long recovery afterwards for some people.
And this particular virus isolates you during that critical point when you can't see your loved ones. Yeah.
And that's the newest literature that is coming out, the psychological aspects of this disease that we're starting to see the fallout from. And that's tough.
I want to touch on that a little bit, and I'm going to talk for a little bit while I get there. And if it's too personal, I appreciate you just saying, you know, I'm not going to touch that. But if you could, even a little bit, that'd be great. I mean, I guess the only way I can relate to you is from a first responder perspective. I mean, I volunteer here in Cheshire. It's not fighting fires in New York City, but I've seen some things. I understand trauma, and I understand the effect it has on your mental capacity and your heart and everything else. And that's it. I've never had anybody telling me that, you know, what I'm doing or what I'm working on is not real, or it's made up, or it's a conspiracy, or so I can only imagine that those feelings you get from trying to save and help people, combined with somebody screaming and shouting that this is a made up thing, open it up. How do you, as a person, how do you put that aside and go to work the next day?
It's a good question. First of all, please do not minimize the first responders' role in all this, because they are, you know, if the nurses are 1A, the first responders are 1B. Like you don't know what's out there, and everything you respond to, it could be, I guess, the proverbial mine that you are coming across. A lot of it is hyperbole to me, I guess, in the sense that, or maybe hyperbole is not the right word. You hear about it on social media. You see the things where, you know, there's active deniers of the disease while they're in the hospital, as they're sick and they're getting treated, and they're telling their providers that they don't have this disease. I have not personally come across that. And I will say that my faith in humanity is I believe it, that probably 99.99% of people out there, they appreciate the care that they're getting. And when they're in the hospital, that they believe it's a disease. And what we see is the dark underbelly of the 0.0001% of, the deniers. While they're in the hospital, I think it's a larger percentage outside of the hospital. Yeah. So I think humanity is good.
About 25.
Yeah. Yeah. I think they're good. I've not come across anybody difficult that I've had to take care of. And they're all very grateful. They're all very grateful.
So, and after giving that kind of emotional give all day at work and watching the suffering and knowing the suffering, you are keeping yourself together. How?
In medicine, there's always gallows humor. We oh, puppy. Oh, my goodness. That's how I keep it together, puppy. We have a dark cynicism. Maybe we're scarred. Maybe that's what it is, and it's hard to penetrate those scars. And don't get me wrong, there are definitely events that happen that break through those scars. But sure. And as a first responder, you've seen the worst of the worst, and everything hits you to a certain extent. But I hate to say it, I was just at something where people were kind of making fun of the Monty Python saying not quite dead yet, and
I'm not dead.
Mm-hmm.
Exactly, and that's what we say inside.
I feel fine.
Exactly. You know exactly what I'm talking about.
It sounds like compartmentalization. It sounds like a psychological trick, an emotional trick, which is necessary for you to do your job, probably through a lot of other stuff too, not just COVID. But I would imagine there's more of like a wartime carnagey feeling some days, rather, with going through this than maybe 4 or 5 months ago.
Yeah.
And as long as there's places to reach out, and I'm sure you have comfort in numbers and comfort in community, and we're always here if you want to laugh and make fun of ridiculous things. Make sure you come on the show.
Yes. Oh, I will be happy to do it. But I think you said community. Community's right. I think that's where I reach out. It's funny because if you want to do a whole nother show on being an introvert, I'm learning this whole new of me. I'm embracing myself as an introvert, so I don't really reach out to people. But there is safety in numbers to a certain extent, comfort in numbers for sure. So
yeah.
But it's you trudge on. What else can you do? And
one foot in front of the other. There are other things to do. You just, you make it work.
Yeah.
Part of it is I do say to myself that people are worse off. You talked about what we talked about in the beginning of the economy and unemployment. I mean, I'm happy I'm just healthy and I have a job.
I feel happy.
Exactly.
Sorry,
people are suffering.
I'll do Monty Python all day with you.
Yeah. Yes. Red, no blue.
We are the Knights of Knee.
Knights of
Knee. So, we make a lot of Pawnee Mython. Forget it. Whatever. It's been a long way. We make a lot of references.
I'm getting better. No, you're not. You'll be stone dead in a moment. Well, I can't take him like that. It's against regulations. I don't want to go on the cart. Oh, don't be such a baby.
Bring out your
I can't take him.
Oh,
bring out your dead.
I feel
not funny right now.
Well, do me a favor. I can't.
You have places to go and people to see, Dr. Wu.
No, I'm actually good. My kid can start his own Zoom meeting without me, so I'm good.
We're going to Shanghai, haven't you heard?
Oh, that's right. That's right.
You should jump on the webinar and come sightseeing with us.
Not worth it if I'm not eating.
What do we need to know? Phase 2. What do we need to know? What are we looking at?
What's the biggest concern coming up with phase 2?
Yeah, I think it's good to definitely touch on this. The virus is still out there. We're testing more people, and I think everything that we talked about with the hygiene and social distancing, when we talked about it 2.5 months ago, 2 months ago, still holds. There is no vaccine. And what am I doing to combat the fear or the loss of fear that is happening? I'm telling people, if you're not worried about yourself, be worried about what you could give to others. And those who are maybe less fortunate, those who are older, those who are immunocompromised, those who are immunosuppressed. You may be completely asymptomatic and you can pass it on to somebody else. And I think that's an important message that we need to remember. If the fear for yourself is not there, remember that you can pass it on to somebody else.
We don't have to package it as worry or fear either. Like, we don't have to package it as worry or fear. We can package it as mindfulness. Yeah. We can package it as efficiency. We can package it as concern, care, community. We can get rid of the whole, I'm not afraid. I'm not afraid. I'm not afraid of the virus. I'm not afraid of other people getting the virus. I'm not afraid of people dying. It's not a fear. It's a concern. Yeah. It's an awareness. It would be awful if I knew that by my lack of efficiency gave it to somebody who couldn't handle it, who couldn't survive, and didn't have the same survivability as somebody else. I don't know if I could live with that kind of lack of compassion. So I know a lot of people are saying, we're not afraid. We don't, that's packaging right there. That's messaging. We don't need it. We can get rid of fear. We can get rid of control. We can get, we're going to move into a phase of awareness.
Yeah.
And concern and common human courtesy.
Yeah.
I think.
I love that. And I'm actually going to take that because I don't want to talk about fear. You're absolutely right. I like the idea of courtesy and mindfulness. I love that message. You're right.
I think. It's a counter message right now. I'll be honest. It's not one that but every time I hear it said, people are like fear and worry and anxiety. And no, it's not. It's awareness. It's awareness. True. And it's being, I'm okay with it still being novel. I'm okay with learning something 3 weeks ago and it being, taking measures to accommodate that new science. And then learning 3 weeks later that it's been disproven or it went in a different direction. I'm okay with that change. Yeah. For me, that doesn't negate science. For me, that's how science evolves. Even if I bought one medicine and then 3 weeks later, oh, that's the wrong medicine. Okay, let's try this. I'm okay with that. That kind of unknown doesn't frighten me. And I think we should embrace it more. And especially considering this is only the first dip in the roller coaster. This ride is long from over.
Yes. I think, yep, you're right.
Go ahead. I didn't want to step on your thought. I'm sorry.
No. The roller coaster imagery is correct. And I would expect at least for this year, possibly 2 or 3 more hills that are coming.
Yeah.
Okay.
You're right. Yeah. And to give you the timing, so we reopened a little bit on May 20th. It's about a 1 month, 3 to 4 week lag. So we'll see what happens in mid-June with the numbers. There's talk of another fall surge and a talk of another winter surge. But I like
in
the
tandem with the flu too, the winter one.
So,
the fall and
they
winter.
call that the double curve. Yeah, the double curve.
Okay.
Oof.
Okay. Is it possible somebody gets both at the same time?
So the original thought that was possible. So double infections, super infections, especially with bacteria. I haven't seen a lot of science to really support that, but the theoretical promise of that is still possible, I'm going to say.
Is it possible that if you had coronavirus and you got a flu test, that you could have tested positive for the flu, but really had COVID?
No.
Asking for a friend.
Yeah. If you tested positive for the flu, you probably had the flu. So the COVID test is very specific for COVID. And the flu test is specific for flu.
Well, I was just curious.
But you could have had both.
Yeah.
Well, I mean, science doesn't take that out of the equation.
Yeah. So possibly, but I haven't seen it. But that doesn't mean it doesn't exist. Sasquatch exists. I haven't seen him. So
what about reinfection?
Reinfection. So great question. They used to think that there used to be a reinfection, but there's been some good studies that, people have tested negative and then they've tested positive again. And they were like, oh my goodness, they're reinfected. But it probably had something to do with the testing collecting method or the inability to get the virus as well. There has not been really solid documentation of reinfection, but yes, that also remains a theoretical possibility that we are all very wary about. Wary.
So why are our antibody tests only 50% accurate?
So antibody tests, it depends which one you're talking about. I did say talking. I'm sorry, I said talking.
Talk. Did I might have brought it out of you.
I'm from Jersey. Yes. Antibody tests, depends which one. The antibody tests that we are using are actually pretty good. So if they're positive, it means that you are positive. The issue is if you're negative, it doesn't necessarily mean that you're negative. We're not sure about that.
That's important. That's important for passing on the virus to other people, because if you get a negative test, you could be like, party! You know what I'm saying? And you could be asymptomatic and spreading the love. But I get it. We're doing the best we can.
People think that a positive antibody test, so that means you've been exposed to it. It's a passport immunity. That's what they think it is. So you've been infected. It's like, I can't get reinfected. I've had it. So party, Gotcha. It's the negatives that are like, oh my God, I've never had it. That means I can still get it. But it's not a passport immunity. And that's one of our, if speaking about Monty Pythons, that's one of our holy grails. We are hoping
I like
that you have the immunity once you've gotten it, that an antibody test can be a measure of passport immunity. But we're not there yet. We're definitely not there yet.
Okay. Well, at least we have an antibody test, right? I mean, baby steps.
Yep. Baby. Yes, exactly.
Okay. Wow. Whew.
Yeah, a lot.
Yeah. I can go on forever, but you have a flight.
We're going to have you on again in another month and a half.
Yeah.
We do. I'm so excited. Shanghai.
But what is the airspeed velocity of an unladen swallow?
Blue, no green.
There are probably people who have no idea what we're talking about. Right?
32 miles per hour. Is it egg heavy?
5.
I need to show that to my children. They have no idea what I'm talking about right now.
If they saw Monty Python,
they would think
we were out of our minds. That's like Benny Hill. It's like along the same line. They just would look at us like, are you for serious? You can't be wasting my time with this. But then watch one of their shows. You feel the same way.
I'm an enchanter. There's some people that call me Tim.
My kids have drawn me into their world sufficiently. So I've seen all the Avengers.
Rick and Morty?
No Rick and Morty. They're superhero people. They like the superhero stuff.
I drag my kids to those movies. I have to have kids with me. Otherwise I feel weird. This middle-aged chick just sitting in there like, why does Thor have a dad bod? Like all mad.
With the big tub of popcorn.
I'm still mad at that.
Well, listen, we only have you for so long. We got to move on to our next venture. But every once in a while we have an episode on this podcast, and I realize that we created something good and fun, and without this platform, I wouldn't have met you. And I am honored to know you and to be able to communicate with you on this level, to really get some honest insight. I like that you're not like the textbook response, and you're very open. I'm just glad there's people like you that believe in science and that are there to provide those of us that need it health and medical care, and you're a good person, and I hope that even through the struggles that I know you must have, and you understand that you are doing the right thing, and what you do is admirable and appreciated. So I thank you very much.
thank you for your kind words, and I thank both of you for allowing a platform for normalcy. This is if we can spread the gospel. All I talk about is if I have a soapbox to spread the gospel, and I think you have actually helped me more out because this is therapeutic for me, and this goes back to the discussion of how do you deal with this. And talking about it is therapeutic, but being able to spread the gospel is even more important for me because I do want to spread truth. So thank you both for the work you do, and thank you for as a first responder. It's amazing. So thank you.
Trisha says I'm supposed to say you're welcome. Thank you.
That's so easy. You're getting so Corey. You are such a good patient.
Yes.
You put it right into practice.
Yes, I have a hard time with any compliment.
Thank you. See, thank you.
But you two are the best. Thank you so much. And happy to come on anytime.
We really
easier.
Enjoy ourselves. We really enjoy the show.
We love like my whole family. I love being on with you.
Well, be careful because
someone was on with us earlier. I saw him in the background.
Yeah, we saw one of your kids.
Yep, he's just wondering why is he talking out the window.
Nice. Well, be careful. We might end up calling you to co-host with us. So.
No, I can't do that. I can't do your job, but I'm happy to talk about poo and introverts. Either of those.
Well,
get me on.
There'll be a show where
you just described me and Corey perfectly.
Pretty much.
Wait, who's the poo and who's the introvert?
Poo.
I'm the introvert.
So he's the poo. He's Mr. Hanky.
I am the poo.
Oh my gosh, that's so funny. Summed up in 2 words. We appreciate you coming on, and I actively enjoy engaging in people who can answer questions without a spin. Like I'm asking you questions without a spin, and the fact that you can just answer them with like science dripping off of every word.
Right.
I miss that in everyday life because it's so hard to find. So thank you for providing that, not only for us, but for everybody who listens, because they're tired of it too. It's more than just a COVID fatigue. It's a messaging fatigue. It's everything's so contrived. Thank you.
Where do you live? What town?
So we're up here in Farmington. We're in the valley.
You're in Farmington? Okay. I'm going to fart in your general direction. I'll do that all
I
night
wouldn't
long.
even know what direction that is.
It's that way.
Southerly winds. I don't know. I think winds are blowing the other way.
If you still have a sense of smell, that's a good sign.
For those that don't know, I'm still quoting Monty Python.
Yes.
In your general direction.
So would that be Fartington? Sorry.
Oh my gosh.
Well, we gotta go now.
That was awful.
Doctor's trying to make jokes.
It is now.
Oh, awful. I'm sorry. I'll dab.
Oh, no. He's dabbing.
That's even worse. That's even worse.
Well, you're going to make me a joke again. I'm laughing.
Oh, my gosh.
Oh, no. Corona.
No, you know what? It's all the years of smoking, man. And if I laugh too hard, that happens.
It's the early emphysema. Your mic needs a mask next week.
I've quit smoking, though. So, 2 years
you're
ago.
You're going on years.
Yeah.
Good for you.
Yes.
Quitting smoking is freaking hard.
Good for you that you stopped, though. That's maybe the best thing you've ever done in your life.
No, the best thing I ever done was said, "Will you marry me?" to Jen, and that literally the best thing. And then there was 3 others.
He's right.
That's Emily, Connor, and Ian. Everything else is just
You had very little to do with that.
That's true.
Very little. All right, folks.
Well, all right then. Doc, thanks so much for being part of the episode and sharing with us.
Stay strong.
I can't wait till we see you with a haircut. I do appreciate your COVID do.
Yes.
It's quite rad. Mine too.
Spiky Asian hair.
Yeah.
Mine just grows and grows and grows.
So as we close the show, I'll remind the good doctor and all our listeners that our Patreon is by the time this episode is out, that our Patreon will be live. So visit us at the CheshireCast.com, sign up for Patreon. Pick your support level. We've got great gifts to give you. Like us on Facebook, follow us on Instagram, follow us
subscribe
on Twitter,
on YouTube.
Subscribe on YouTube, listen to us on iTunes or all your favorite podcast apps. We're literally everywhere now, and it's awesome. And now you can be part of the show. Patreon allows you to join us for live webinars. You'll get special access to the whole other show, which is going
special
to be
content.
Yeah, special content. But the whole of the show is going to be those shows where Trish and I say during an episode, "Oh, that's a whole nother show." We're going to literally do shows about the times we say that's a whole
the
other
tabled topics,
right? So
or
a lot of
maybe the culturally sensitive topics.
Yeah, I mean, but it's going to be for our Patreon members. So join us there and, become part of the Cheshire cast. Dr. Wu, thank you again. Tricia,
be safe, good luck, and all that good stuff.
Yes,
Corey.
Thank you, as always, for being my co-host or letting me be your co-host, whichever way.
Mutual.
Yeah.
Ditto.
Thank you for being the cast in Cheshire.
You're welcome.
All right, everybody. Have a great night, and we'll see you next time. Remember, always bet on black.
Stay safe.
Bye. Bye.
Bye-bye.
Bye.